Hello, my name is Melissa Neuman, and this is my presentation on the pathologic condition emphysema. I chose emphysema as my course project because it has a deep root within my family tree. My maternal grandmother died of emphysema at the young age of 47 years old, and both of my parents have emphysema as well. The root has now reached the third generation of our family tree because I also have emphysema. A little information about our lungs. They are the largest organ in the human body. The total surface area equals the size of a tennis court, which is more than 100 square yards. Inside each lung is a bronchial tree. The branches of the bronchial tree, our airways, are different sizes. The smallest of these branches are the bronchioli. At the ends of the bronchioli are the grape-like cluster of tiny air sacs called alveoli. The most important function of the lungs is to provide and send oxygen to other organs of the body through our blood. The lungs also act as a filter, cleaning debris from the air that we breathe in, like dust and allergens. Emphysema is a lung disorder under the umbrella of COPD, chronic obstructive pulmonary disease. COPD is a group of lung disorders that affects a person's ability to breathe. Other conditions under the COPD umbrella are chronic bronchitis, which is when the lining of your bronchial tubes are inflamed, and bronchiectasis is a lung disease that affects the larger airways of the lungs, the bronchi, that are stretched and enlarged. With emphysema, the walls of the alveoli are weakened and eventually destroyed, making it harder for these little air sacs to push oxygen through into the blood, resulting in the oxygen becoming trapped within the airways. Emphysema also damages the goblet cells, the filters within our lungs. These cells look like a goblet glass and produce mucus in which debris gets caught in. On top of these goblet cells are tiny hairs called cilia. These hairs act like a broom and sweep the debris that is trapped in the mucus from the airways. Smoking eventually destroys the cilia and increases the production of mucus. So while the production of mucus is increased, the ability to clear the mucus and debris from the airways is decreased. This results in mucus buildup, providing a banquet table for bacteria to feed off of and for infection to set in. The result of this damage is a slow breakdown of lung function. The main cause of emphysema is cigarette smoking. Other factors include air pollutants like volatile organic chemicals found in construction materials like carpeting, paint, and insulation, as well as manufacturing chemical fumes, and smoking marijuana can contribute to emphysema. There is also a genetic deficiency called alpha-1 antitrypsin deficiency. It is a deficiency in the protein that protects the lungs. Those that have AAT deficiency are vulnerable to getting emphysema even if they have never smoked. Symptoms and signs. First, there is a difference between symptoms and signs. Symptoms are what a person feels, and signs are what a doctor sees or looks for when diagnosing emphysema and the severity of the disease. These are as follows. Symptoms can be shortness of breath, persistent cough, with or without mucus, wheezing, tightness in the chest, weight loss, loss of appetite, poor sleep, and depression. Symptoms are slow and gradual, so they are not noticed right away. They are also progressive, which means over time they will get worse. Signs include barrel chest, clubbing of the fingertips, hypoxia, low blood oxygen levels, hypercarbia, high levels of carbon dioxide in the blood, and malnutrition, muscle structures slowly waste away. Most signs develop in the severe stages of emphysema when symptoms are the worst. There are two main staging systems that doctors use to help in diagnosing the severity of emphysema. The first is the GOLD staging system. Its main focus is the amount of air a person can exhale forcefully in 1 second. This is known as FEV1, forced expiratory volume. As emphysema progresses, it becomes more difficult for a person to empty the lungs of air, resulting in a decline of FEV1. The stages under the GOLD system are Stage 1, mild emphysema. The FEV1 is greater than or equal to 80%. In Stage 2, moderate emphysema, the FEV1 is less than 80% but greater than or equal to 50%. In Stage 3, severe emphysema, the FEV1 is less than 50% but greater or equal to 30%. And in Stage 4, very severe emphysema, the FEV1 is less than 30%. Although the GOLD system is widely used by physicians, the BODE, B-O-D-E, system can give a more complete picture of the effects that emphysema has on many areas of one's life. The BODE system focuses on body mass, weight determined by height, obstruction, airflow limitation, dyspnea, breathlessness, and exercise, distance, one can walk in 6 minutes. The results of either or both of these staging systems aid the doctor in determining the course of treatment. The number one thing a person diagnosed with emphysema can do to slow down the progression of the disease is to quit smoking, if they smoke. Bronchodilators allow the breathing tubes within the lungs to dilate and the muscles surrounding the bronchioles to relax, making it easier for air to flow freely throughout the lungs. This type of medicine is often distributed in the form of an inhaler or in a nebulizer machine. Corticosteroids help to decrease the inflammation within the walls of the breathing tubes. It is distributed in an inhaler like Advair or Symbicort, and for more acute flare-ups, in an oral pill like prednisone is taken. Antibiotics are used for infections that often occur within the lungs. Oxygen will eventually be needed due to the decreased ability of the lungs to supply oxygen for the body. Pulmonary rehabilitation consists of exercise, quitting smoking, medications, and medical management from your physician. Respiratory physiotherapy helps loosen secretions and mucus in the lungs. Life expectancy is hard to determine for someone who has emphysema because each person's struggle is different. With that being said, the stage of emphysema that a person is in can give an approximate life expectancy. For example, more than 80% of people who have mild emphysema are alive after 4 years. 60 to 70% of people with moderate emphysema are alive after 4 years. Around 50% of people with severe emphysema are alive after 4 years. And for those with very severe emphysema, the ones that have difficulty even walking around the house and have severe weight loss, have the shortest life expectancy. The damage to your lungs is irreversible. However, you can improve your life expectancy if you quit smoking. With every puff, more damage is done, and the less air your lungs will be able to use. It will literally take your breath away. This concludes my presentation on emphysema for Amberly Hoyer's Structure and Functions of the Human Body course. It is my hope that I have given you something to think about regarding emphysema. To my fellow smokers, I know firsthand how hard it is to quit. There are many tools to help us quit, though, like the patch, nicotine gum, Chantix, hypnosis, acupuncture, and even cold turkey. It is an addiction, so it may take numerous tries to quit. As long as you keep trying, there is hope. Thank you for your time.